In this video, we'll discuss about the ankylosis of TMJ. So basically, what is ankylosis? It is a disorder in which adhesion of joint components takes place by a fibrous or a bony union, resulting in loss of function. Alright, now to learn the etiology, you must remember one mnemonic, which is sit Naomi. Alright, by S we have systemic, juvenile arthritis. Now it can have rheumatoid arthritis or osteoarthritis. Then by I, what I mean is infection. Now in infection you can have otitis media, osteomyelitis and congenital syphilis. Now by T we have trauma. For trauma you can mention about the malunion of condylar fracture or the radiotherapy to TMJ. Now by neo we have neoplasms, which is very obvious. Over here you can mention about osteosarcoma, osteoma, chondroma, chondrosarcoma. Alright. Now by MI we have miscellaneous. In miscellaneous we can mention about congenital developmental defect in joint synovium. Alright, now coming on to the types. Now to remember the types, there are two types. One is the intra-articular and one is the extra-articular. Now to remember what is happening, you can remember these days NFTs are working a lot. Alright, they are very progressive. That's a very progressive idea. So just remember progressive NFTs. Okay. Now by progressive what we have is progressive destruction of meniscus with flattening of mandibular fossa. Alright. By N we have narrowing of joint space. Then by F we have fibrous, although ossification in scar. So it's basically bone knee union. Then by T what I have is a thickening of head of condyle. Alright. Now in extra articular what we will see is basically the splinting of TMJ by a fibrous or a bony mass external to the joint, proper as in cases of infection surrounding bony excessive tissue. Now coming on to the some predisposing factors. So Laskin mentioned about some predisposing factors. You can remember them by D, CAS. Now this is basically duration of immobilization, maximum 14 days. Then by C you can remember the condition of articular disc. Then age, then site of fracture, severity of trauma. Now in pathophysiology, first of all what will happen is there is intracapsular fracture of bone. Alright, simple. Then what happens is bleeding within the joint, which is called as arthrosis. Now this is a very characteristic feature of hemophilia, right? Then bony fragments, they have high osteogenic potential. Now, organization of hematoma. This hematoma will be converted into fibrous tissue, which is subsequently converted to bone. Alright, now we will discuss about the clinical features. Now in clinical features, what happens is either it can be unilateral or it can be bilateral. There is a deformity. Alright, now this deformity, facial deformity. Now what happens is, in the unilateral, what will happen is chin is displaced backwards and downwards. Whereas here, what you will see in bilateral is that there will be a defect in the growth of mid-face. Now, why is chin displaced backward and downward? Because there is no opposing mandible for growth. Alright. Now, we will discuss about some characteristic features. So, first of all, bird face. Alright, the person will have a bird face. Then, secondly, there is Andy's gump. Then in the ankylosis, what we see is there is delayed eruption of teeth. Also deviation of mandible, chin. Then the person will have a convex facial profile. There will be vertical height deficiency. Now coming on to the oral features, we will have discussed about them. Now some other features like obstructive sleep apnea. Now in radiographic feature, what you will see is that the joint space, it will be completely narrowed. Then there will be irregular articulating surfaces of condyle, which will interdigitate in an interlocking form. Alright, then in histopath, what we will see is that the joint space, it is completely filled with fibrous tissue. Now for the treatment, we can do surgical treatment if it is diagnosed at an early age. Usually it occurs in children who are less than 10 years of age. So what are the surgical procedures that you can do is gap arthroplasty, condylectomy, interpositional arthroplasty, then we can do joint reconstruction. Now one thing that you must mention in your exam or in the answer, that is Sahni's classification, Sahni's grading basically of ankylosis. Now he divides them into 4. Okay, 1, 2, 3, 4. In first one, what we see is there is flattening and deformity of condyle with little joint space seen on radiograph. That is, there is extensive fibrous union or adhesion. In second one, what you see is there is bony fusion of the outer edges, bony fusion of outer edges of articulating surfaces with no fusion in deeper areas of joint. In third one, there is bridge of bone which is seen between the ramus of mandible and zygomatic arch. In fourth one, what you will see is that the entire joint, it is replaced by a mass of bone. Okay. Now in this, what you will do is you will show the flattening and some of the joint space, and this is the ankylosis happening. Now over here, what you will do is you will basically show the articulating surfaces being fused. All right. Then in the third one, what you will do is there is basically you will have to show it like this because it is extending, right? So yeah, this is it. Now in the fourth one, what we do is basically the mass of bone, right? So we will make the mass of bone. Yeah, so this is the classification which was given by Sani for the ankylosis of TMJ. So I hope you found this video helpful in understanding. Thanks for watching.